Hello everyone, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about domestic violence, anger, and diabetes. So, if you like the videos related to my health, my way, I would like to request you all, please do subscribe the channel, hit the bell icon, and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin. Let's go. Now we will talk about the domestic violence, anger, and diabetes. Everyone has experienced anger at some point, the mood swings caused by low blood sugar. Low blood sugar can affect a person whether they have diabetes or not. For patients with diabetes, the mood swings coupled with the general anger and frustration of having chronic disease can be tough to manage. It's a lot to cope with, and at times it may really be upsetting to have to deal with diabetes day after day for a lifetime. Now, your partner's diabetes may cause you to overlook or make excuses for angry reactions, which is okay to an extent. However, anger that escalates into physical, verbal, or emotional abuse should never be tolerated, and it is treatable. With self care and preparation, most severe mood swings are avoidable. Now, the blood sugar and emotions. The fluctuating blood glucose levels that characterize uncontrolled diabetes can contribute to mood swings and lead to unpredictable or even aggressive behavior. Now, what's sometimes called diabetic rage can be dangerous because it may involve behaviors a person is not consciously aware of. Psychologically, when someone's blood sugar fluctuates, spikes, or drops, it can produce feelings of anger, anxiety, or depression that are out of control of the person experiencing them. Now, more seriously, extremes of both hypoglycemia or hyperglycemia can lead to cognitive impairment, confusion, loss of self control, or hallucinations. These conditions should be considered a medical emergency. Now, why anger becomes abuse? Every person has a right to get angry sometimes, but it is not normal for someone with diabetes to erupt into anger and take it out on others. If anger is expressed violently to hurt or scare you, then it becomes domestic abuse. Abuse can be actual physical contact like hitting, slapping, pushing, or otherwise inflicting bodily harm. But it can also be threatening or belittling you or making you feel intimidated or scared. Now, what to do if you are struggling with diabetes and anger? If you or a loved one have diabetes and experience mood swing as a result of low blood sugar, there are ways to manage. Now, eat consistently. First and most importantly, watch your diet and always eat consistently. Experiment until you know what will actually or what will quickly regulate your blood sugar. Take good care of your self. Taking medication and eating right regularly are essential components of keeping your blood sugar under control, since the hormones that regulate blood sugar also regulate stress level. When your blood sugar is off, you can become enraged and depressed, which is turn make it harder to regulate your blood sugar. Keeping track of your blood glucose level will also help you learn how and when anger affect you. Now, learn to relieve emotions. Various techniques are proven to provide relief when you do feel anger or stress. Regular exercise, meditation, and yoga are particularly excellent ways to balance out and process emotions. You can also try talking or taking a walk, writing in a journal, or breathing deeply for a minute or two. Avoid catastrophizing and ask yourself questions. How important is it? To help keep things in perspective, therapy to talk about your feelings may also help you work through frustration and come up with practical ways to better manage moods. Now, keep emergency snacks on hand. Never wait too long to eat, particularly if you know anger is an issue. Ask for help. Don't hesitate to ask your doctor for a referral to a diabetes educator or nutritionist. Services are also now available to connect you to your own personal diabetes coach. Now, consider a continuous glucose meter. Never or newer technologies can make it much easier to monitor blood sugar or prevent severe fluctuation if mood swings are an issue. For you or someone you love, continuous monitoring may be the best or the safest option. Have a plan. Sudden changes in blood glucose level can be life-threatening. Talk with your caregivers, family, and neighbors in advance, and be sure everyone knows what to do in an emergency. Calling knowledgeable paramedics or for assistance is the safe safest option. Now, what to do if your partner experiences mood swings? It's not your responsibility to make sure your partner consistently eats well, but knowing the crucial role diet plays in managing mood for people with diabetes may help you understand their condition better. Don't underestimate the importance of their diet and regular meal times. If your partner struggles with managing mood as a result of fluctuating blood sugar, talk to them about it. Have a plan in place for emergencies such as calling paramedics immediately at the first sign of a mood swing or outburst. Your partner should be willing, if not eager, to create an emergency plan for the sake of your safety and that of others. Now, if you are in a relationship that's abusive, it's important to tell someone you trust, a friend, a counselor, a social worker, or a healthcare provider. Abusive relationships are often isolated ones, where the abused partner lives in a secrecy and fear. Telling others break the silence and enables you to more easily seek help. That's all about the diabetes in this video. I hope you all liked it. I will definitely come with the next video with my own other content. Till then, stay home, stay safe, take care of yourself and your family. God bless you and take care.